My name is Brittany Perry, and I am a clinical assistant professor of pediatrics at Nemours Children's Health. At Nemours Children's Health, we are in collaboration with our Swank Autism Center at Nemours Children's Hospital. We have been expanding access to primary care autism assessments for quite some time. We know that families wait a really long time for autism assessments, sometimes upwards of a year. And so completing these evaluations in the primary care setting, the primary care pediatrician is often the first to identify an autism concern. And so once that concern is identified, they often have more availability to schedule a follow-up assessment shortly after the concern is identified to complete that assessment. So, for example, in our primary care clinic, we have been getting children in within a few weeks to 2 months. So yes, in our primary care clinic, we are a resident continuity clinic, so we do train residents in this clinic. And so we took the opportunity to include residents in the autism evaluations that we were doing. And so the resident would actually identify the concern at their primary care well visit, and then we would schedule the evaluation with the resident and the trained primary care pediatrician a few weeks to upwards of 2 months after the concern was identified. In that interim, we trained residents on autism care, gave them additional resources to learn more about autism, and trained them to use one of our autism diagnostic tools. We met with the residents, we provided education on how to conduct the evaluation, and I think most importantly, how to talk to families using a neurodiversity affirming approach and focusing on strengths. So that to me was one of the most important things that we did through this evaluation process. Training providers in their residency, getting a head start on providing additional skills to not only screen for autism and evaluate for autism, but provide better autism care starts in residency. We know that regardless of which path a pediatric resident takes for their career, the skills that they learn, not only for autism screening and autism diagnosis, but providing good autism care and using neurodiversity affirming strategies with patients and families will carry through with them regardless of the field that they pursue. We also think that some of the providers, and we've heard this from some of our residents who have participated in autism evaluations, that the skills they learned specifically through completing autism evaluations has improved their ability to recognize autism concerns, evaluate for autism, and talk with families using neurodiversity affirming strategies and connect them to the appropriate resources. The American Academy of Pediatrics recommends routine autism screening at 18 and 24 months. So our primary care pediatricians are the ones screening for autism. Being able to identify an autism question at a well visit and have the knowledge and strategies to support families while they're waiting for a diagnosis or waiting for an evaluation is really important. You know, we have an opportunity. We are screening for autism in our primary care offices, right? And so every medical resident will be participating in screening in their primary care clinic. So taking that a step further, as more primary care providers are conducting autism evaluations in primary care, including the medical residents in that process, helps to strengthen their skills, not only for screening and diagnosis, but communicating with families, sharing intervention recommendations, and utilizing a strength-based approach.